Hello, Bay Area. You're listening to Radio Mirchi 1310 AM, and this is your one and only RJ Mirchita. And I know, right? આજે આપણને ઓફિસ જવાનો જરાય મૂડ નથી because long weekend and we had so much fun અને આપણે જલસા જ કરે છે, આપણે binge watch જ કર્યું છે ને. I understand, but anyway, we have to get back to work, and that's why today we have very interesting COVID awareness show day 55. Today is our day 55th, and we have a very amazing doctor with us who is actually an orthopedic but kids માટે. So I think when I was very young, ત્યારે my ba એટલે કે my grandmother used to sing this song. એટલે બધા આમ ભજન ગાય ને પેલું ગાય ને all that things, and I think there's this whole thing about kids કે ભાઈ kids ને માલિશ કરો ને kids ને આ કરો ને kids ને આ ખવડાવો અને kids ને કંઈ પણ થાય તો આમાં આપણે એટલા ઓવર પ્રોટેક્ટિવ થઈ જાય છે. અને એમાં પણ in case if it's a girl, so the highly overprotective because she has to look beautiful, she has to be in a certain way, she has to do this, she has to do that. And if it's a guy, then again there's a whole new world કે એને આવી રીતે બિહેવ કરવાનું અને એમાં પણ let's say God forbids nothing happens to you, but in case if something happens, in case accidentally the kid fell down or through accident something happened, that becomes very tricky to operate on little young kids, barabar. And we have all faced this challenge. But now with technology and with great doctors, we are able to overcome a lot of things that you will see in the presentation, which Dr. Rohan Parwani is going to share with us today, along with Dr. Modha. So today we are going to chat on pediatric orthopedics and COVID-19. So let me go ahead and tell a little bit to you guys about Dr. Rohan Parwani. He graduated with MBBS from SBKS Medical Institute and Research Center in 2010, completed his residency in orthopedic surgery from Pramukh Swami Medical College in 2014. He also worked as assistant professor in Department of Orthopedics for about 4 years. Currently, he's running his private practice at Saishav Children's Orthopedic Hospital at Rajkot, Gujarat, India. He has completed, oh my god, many fellowships and observerships across the globe. Some of them, થોડી ઘણી હું તમને કહીશ because there is a long list. આપણે વેક્સિન લેવા જાય તો આપણે લાઈનમાં ઊભું પડે ને, એ ટાઈપનું છે ભાઈ આમનું ઇન્ટ્રોડક્શન કાંઈક. So he did 1 year clinical fellowship in Pediatric Orthopedics with Dr. Ashok Johri Child Orthopedic Clinic, Mumbai. 1 month observership in Pediatric Orthopedic with Dr. Mirchita Mehta and Dr. Alaric at Baijarbai Vadai Hospital, Mumbai. 2-month observership in Pediatric Orthopedics at A.I. Dupont Hospital for Children, Wilmington, Delaware. Then he also did ISSH Traveling Fellowship with Dr. Mukut Thate, Pediatric Relay Plexus and Plastic Surgeon. Hey, when you do a fellowship with plastic surgeon, that's a whole new level of learning, right? કારણ કે it's not about just joining the joints, it's about the aesthetics as well. કે આપણે એમ ના કહીએ કે આપણે નોકિયા ફોન વાપરતા હોઈએ અને સડનલી તમને આઈફોનની સ્ક્રીન આપી દે તો that's how it is. But આપણે એમને જ પૂછીશું કે એવું હતું કે નહીં. 1 month observership at Sick Kids Children's Hospital at Toronto, like Canada, from 2017 July to August 2017. Bhai, okay, Titi, global doctor share. 3 months visiting fellowship at Texas Scottish Rite Hospital at Dallas, Texas, here in 2018 in USA. He's also a recipient of Children's Orthopedic of Underserved Region with Pediatric Orthopedic Society of North America. Well, that's really great. કારણ કે there is a lot of underserved area here જ્યાં એટલા qualified doctors નથી હોતા, and even if હોય છે તો they charge a lot of money. કારણ કે પેલું ના કે ગુજરાતીમાં proverb છે કે ભાઈ ડેઝર્ટમાં તમને કોઈ પાણી આપી દે તો એની કેટલી કિંમત થઈ જાય નહીં. But yeah, that is what it is here in US. And he also has completed level 1, level 2 and certified in cerebral Plessy-Gate course in 2018 from Minnesota in USA. He has also been a member of several medical associations. Some of them include Psychot since 2020, Indian Medical Association since 2012, Indian Orthopedic Association since 2014. પછી આવે છે interesting Pediatric Orthopedic Society of India since 2016. I'm quite curious કે આવું કંઈક હોય છે. We'll ask him. Indian Academy of Cerebral Plasty since November 2015, Indian Society of Surgery of Hand since 2017, and have also published many research papers and attended several conferences. So this is a little bit about Dr. Rohan Parwani, and now I'd like to invite our one and only founder of Gokul Group of Hospitals, our Bhishma Pitama of Surgery, and our favorite doctor, most popular doctor, Dr. Prakash Modha, who is the surgeon, to share about COVID na statistics. એટલે કે આપણે ડિસ્કસ કરીએ છીએ કે ભાઈ કોવિડમાં કેટલા કેસીસ આવ્યા છે, કેટલા મોર્ટાલિટી રેટ છે યુએસમાં, ઇન્ડિયામાં, ગુજરાતમાં, રાજકોટમાં. So now I'd like to invite Dr. Modha. Welcome, Dr. Modha.
Thank you, Mirchita. Good evening, viewers in India, and good morning, viewers in USA. I will share the COVID statistics, latest COVID statistics. In USA, there are 5,371 new cases and 41 deaths. In UK, it is 27,100 new cases and 9 new deaths. Coming to India, it is 34,703 new cases and 553 deaths. So the death rate is coming down, and so is the cases. In Australia, it is 46 new cases, and so far no death has been reported since so many days. So we salute to Australia.
But 46 થઈ ગયા, Dr. Modha, 46?
Yeah, 46. And they have put lockdown in, partly lockdown in Sydney and Melbourne.
Okay.
So now coming to Brazil, it is new cases are 22,703. But death is high, 695. In India, we have 34,000 cases, 553 deaths. Here 22,703 cases and 695 deaths. So Brazil death rate is high compared to India. And coming to Gujarat now, 62 new cases only in Gujarat and 2 deaths only. Then coming to city-wise cases, so Ahmedabad has got 15 new cases, Surat has got 11 new cases, Baroda has got 8 new cases, Rajkot has got only 3 new cases, and Bhavnagar has got 5 new cases only. So, and one more thing about the vaccination. Today we have done vaccination of 2,99,680 our 80 doses of vaccination has been given to our people. So it is very good. Almost 3 lakhs vaccination has been done today. And that's why we are trying to fight COVID.
Excellent.
And this is the latest statistics. But England also is improving. India improving, USA improving. All countries are improving in COVID cases, but death rate in Brazil is little bit higher. So this is the latest statistics. Now I'll request Mirchita and Dr. Rohan Parwani.
Dr. Rohan is here. Hello, welcome, Dr. Rohan.
Thank you for having me.
Carry on.
Such a pleasure to be here.
Latest updates, COVID and pediatric orthopedic surgeon. Dr. Rohan is a very good pediatric orthopedic surgeon and the only one pediatric orthopedic surgeon of our Saurashtra and Kutch. So
really?
we welcome him and we are proud of him.
Thank you.
And he's doing a great job for our kids from Saurashtra and Kutch, as well as from the surrounding area. Thank
Thank
you.
you. Thank you, sir.
Over to you, Mirchita and Rohan.
Thank you so much, Dr. Modha. See, this thing I did not know that he is the one and only orthopedic pediatric surgeon in the entire Saurashtra. Like that brings a lot of pleasure to invite you on the show, Dr. Rohan.
Yeah.
Um, and tell us a little bit about how orthopedic and pediatric orthopedic is little different, and then we can start with the questions.
Yeah. So what is different is that I deal with children, and children, what we like to say is they are not young adults. They are completely different things. They have different set of emotions. They have different set of their body physiology. The body mechanism is different. It's different how they hurt themselves, how they treat themselves, how they heal themselves. Everything is different from children and adults. So the sort of things that I deal with is somewhat of routine fractures that we see in adult, but they behave
Mm-hmm.
differently in children. So I deal with a lot of trauma that happens to children. Other than that, there are a lot of congenital deformities that happen to young children,
Uh-huh.
and I have a special experience in treating them. And then there are some other rare things that happen in legs and hands of children, and I have a special expertise in treating them also. So what is different from adult is that a lot of these things which are not treatable in adult, they I can treat them in children, and then we can make their lives better. So
Excellent.
that's what my usual day is like.
Excellent, excellent, Dr. Rohan. So the first question I have for you is what sort of work you are doing in your daily practice?
So daily, as I said, that I'm dealing with a lot of pediatric trauma. So what happens is that children, they are some, most of them are naughty and they are happy-go-lucky, and they roam around and they jump and they do all sorts of crazy things, and then
Yes.
they sometimes they hurt themselves if they are unlucky. So I get a lot of pediatric trauma. So it's something from a small finger injury to big fracture, and there are different ways of treating them. And that is one part. There is a small part of my practice. Most of my practice consists of congenital deformities. As sir said, that there are very few doctors who deal with birth defects that happen in
Yes.
children, like defects that happen in foot, that happen in hand, that happen in spine, hip, etc. So I deal with a lot of birth defects. Then there are some different things that happen in special region of children, like in hip, that happen after birth. Then they are considered to be deformity only, but I deal with a lot of those deformities that happen after birth also. And then there are all sorts of minor pains and aches that happen in adult. Similarly, they happen in children also, and there are different set of reasons for them. So I deal with a lot of different problems, small minute problems that growing up children, adolescents have, or young children have. And I devise innovative ways that fit into a child's daily routine, and parents are able to do it at home. So all that comes in OPD practice. Other than that, finally, there's a lot of neurological conditions like cerebral palsy that happens because of some birth problem that a child faced, and then when he has grown up, he has got difficulty in walking or doing some activity. So I deal with a lot of cerebral palsy kids who are special kids. They usually have they have some mental problems, they have some learning disabilities, they have walking problems. So I make lives of these kids better. I try my best to make the life of these kids better. So this is a general broad outline of the sort of work that I do.
Excellent. Dr. Moda, any comments?
Yeah, very good. And he also does spine corrective surgery. He
Hmm.
also
Yeah,
does
yeah.
this, you know,
Club foot,
equinus deformity, club
the
foot,
foot deformities, birth
yeah, foot
deformities.
deformity, hand deformity. So he does a lots of good job for the kids.
All right. So yeah, and there is a stigma also, right, around these kids. કે છોકરી હોય તો આવી જ હોવી જોઈએ, છોકરો તો આવો જ દેખાવો જોઈએ. Like there is all these things, right? અને કદાચ કઈ એક્સિડન્ટ થી થઈ જાય તો લે હાય હાય તમારા છોકરાને શું થઈ ગયું? And I'm like, okay,
yeah,
calm down,
that's a
right?
that's a routine thing that we face. There is a lot of bias for
Bias.
daughters there, and parents are sometimes more. There are like two extremes. Some parents are reluctant to get girls treated, and then there
Yeah.
are some who are overcautious about, because she's a girl, you can't leave a scar on her, or she is precious, she has come after 15-20 years, so we don't want to do anything to her like which will harm her. So there are a lot of different parents, and dealing with kids become a major part of my practice. When
Your
I'm
practice.
I try to spend almost half an hour talking to each parent, and making them ready for the treatment that I'm going to offer, even though I'm not doing any surgery, but explaining the details of the future things that can happen. And dealing with sentiments is a huge part of my job. Often the surgical part or the treatment part takes just 2 minutes, while the counseling part takes almost 25 to 30 minutes. So
That's what
dealing
I
with emotions is a big thing.
Right, that's what I wanted to highlight. But glad you mentioned that, because a lot of people, especially in villages, they are very reluctant and hesitant to even approach a doctor.
Yeah.
કંઈક થઈ ગયું છે તો ભલે થઈ ગયું, right? But glad that you clarified it and you are
Yeah.
providing those kind
As
of
sir said
services.
that there are not many deformity correction surgeons here.
Yeah.
Yeah,
Yes,
as
yes,
sir
yes.
said, there is not a lot of doctors who do it. So again, there is similarly not a lot of awareness. So even good doctors who have been practicing since long don't know the sort of treatments that I do. And I always try to make an awareness of the things that I do. That's why I attend all these interviews and all that. And we try to make them aware of the treatments that I offer. So when they see these kids, they are able to timely refer them. So again, that is a good thing that I need to do, make people aware of the sort of treatment that I do.
Thank you, Dr. Rohan. The next question, which is interesting, which I have for you, is how are children's bones different from adults? Dr. Rohan, are you there?
So this is a more of a basic question. Like it, can you hear me?
Yes, yes, yes.
Yeah. Okay. So this is a sort of basic question, which sort of underlines my whole practice, is that a child's bone, the physiology, the mechanism of the internal mechanism of a child's bone is different from an adult, because it's a growing bone, and it has a lot of potential to change shape. That is, when a child is born, the length of a long bone is like this much. It is about a length of two fingers, and then that grows to a 30 centimeter, or a 1.5 foot long bone. So all that gives it a lot of capacity to heal itself, and that's why most of the fractures or the bones that break in children are easy to treat, because as they become long, then they can heal themselves very well, because there's a lot of blood going on in there. And it's the fractures are easier to treat because they unite very easily, and then they change shape and become normal because of the lot of growth potential there. But then again, it's the growth potential is a double edged sword, because they have a lot of growth potential. There are specific areas from where the bone grows, and if a sort of injury happens on those areas, the injury might be due to infection or due to fall, and if those growing areas become damaged, then future deformities can happen. So the growth potential that a child has is a double-edged sword, and that makes it different from a bone of an adult, because an adult's bone is already long and set, and there is not lot of potential to develop future deformity. But a child's bone, it can develop a future deformity if the injury is not identified properly at time and treated properly. So that's bottom line of my practice, that we need to understand what happens, what happens at what place in a child bone. Again, a lot of bones in children are also different, and understanding of that bone, what will happen where and at what age, it makes my practice different from an adult orthopedic practice.
I just want to make a comment, and I think Dr. Modha would also agree that when we get grandkids, or when I was a kid, I used to go to shopping like for every 2 months or every 1 month. I'd be like, "My nawa shoes joye છે, મને નવા clothes જોઈએ," because you are just growing very quickly, right? બે ત્રણ
Yeah.
After every 6 months you want to change it. Right, Dr.
Yeah,
Modha?
Yeah,
so glad you
absolutely fine.
mentioned that. Yeah. Yes, sir.
You
Yes, sir.
carry on more on.
No, no, you were saying something, sir.
Yeah.
Yeah, I was saying that kids are growing, so when they got a fracture or something like that, uh, either they have to put the plates or rods or screws or whatever it may be, but they have to remove it after some times so that the bone grows continues. Or nowadays, absorbable screws and plates are available. Ron, what do you say about it?
In children's bones, we usually tend to treat them without any implants because we want to avoid some surgery later on. But if
Yeah,
those become important, yeah, we need to take them out quickly because then the plate itself will get covered with bone of the overgrowing bones, and then taking it out becomes difficult. So taking them out within 1 year
yeah,
is important. So related to growth also, what Ishita was saying is it's important to understand that there are two phases of growth where the growth happens very quickly. That's in young age from 2 to 4 years of age, and then
Uh-huh.
at 9 to 11 years of age. Those are the times when you have to go shopping every 3 months or 6 months because you are growing up too quickly, and then you need new clothes you need to change clothes every 6 months, or you
Every
need to change size of your shoe every 6 months. So that's a nice thing that you mentioned, that you need to do a lot of shopping then. It's a good time actually. You can get to spend a lot of time
lot
shopping.
of money.
yeah.
Yeah.
Ron, what
Yes, sir.
about the absorbable implants?
So they are still under research. They are not widely accepted, and the reason is that they create a lot of local swelling and inflammation, and then sometimes discharge also comes there, and it's
Hmm.
difficult to differentiate it from an infection that might be developing there. So
Yeah,
it's still a lot of research that needs to be done there.
okay.
But if that
And
happens, it would be good, right? Because then you don't have to come back to open the stitches and right.
Yeah, yeah, yeah. If it happens, it will definitely be a good thing.
All right.
okay.
So if any parents are watching, please be mindful. It's not your kids who are asking you to take for shopping. It's literally their age.
Yeah, the shoes become tight. They deserve new shoes then.
Yeah,
It's literally their age. And most of the parents like હમણાં જ તો તને લઈ દીધા હતા હવે પાછું. So
Yeah.
they sometimes don't know, or they sometimes are very busy in their own business or their lives to realize that, oh, my kids are growing up, right? And
Yeah,
kids here, they already have nannies, like they have this maids who take care of the kids. So parents સાથે તો બહુ ઓછું interaction થતું હોય છે અહીંયા US માં kids નું. It's very, it's a great achievement if that happens.
it's
Sorry.
common in India also. It's common in India also when both the husband and wife are working outside. Then it's easy to miss those lovely years that the kids are young and enjoying with them.
Right. So we're gonna take the next question, which is, please share some of your experience by working in COVID hospital in public sector.
So I also work as an assistant professor in a government institute, and during COVID, since there was a lot of shortage of workforce, even orthopedic surgeons, they were requested to give their services to a COVID hospital that was a tertiary referring hospital for the entire Saurashtra. And what really impressed me was the sort of dedication that right from second year MBBS students to right till servants, nurses, and senior doctors, and the sort of dedication that everybody showed, and everybody was trying to make a contribution in their own way, in a way that they can best make. Like second year students were staying up throughout the night and filling up the forms, and making the medicines available, especially remdesivir and all those, because the government had regulated them and made them in restricted supply. So from second year students right till servants who were staying up all through the night, shifting patients from here and there. It was a complicated hospital, and a lot of servants were involved. Consultants, doctors, they were making round the hour clocks. There were a lot of attendants, who were taking care of patients, right from giving them water to moving them to the toilet or adjusting their mask, and so much of service was given that it was really appreciable. And people who graduated from those COVID hospital, they were really appreciative of the sort of individual attention that they were getting. Like there was one attendant for 3 or 4, which was a ratio that is very difficult to maintain in a private hospital. So that was a truly eye-opening experience that such things are possible in public sector also. And it's really a thing of getting
Hmm.
together your resources and prioritizing your aims that you have and how to give a service. So it was really commendable on their part, and I think they saved a lot, thousands of lives, like the timely administration of oxygen and remdesivir to needy patients. So it was a really commendable job done by the government.
It's great to hear that they also wanted orthopedic surgeons to be there and help, because
Yeah, because there was a shortfall of consultants, and they need a mature person to stay at the top and take care of the administrative part. And when there was a really rush of patients, we used to do entire night. We used to stay entire
wow.
nights there and take care of almost 100 patients under one consultant. So it was more of an administrative thing, but it was really eye-opening thing that I said that I got to see these things from very very close by, and it was a wonderful experience. And it was really great fortune on my part to be a part of this nationwide effort.
Excellent. Thank you, Dr. Rohan, for this great answer. Because આવી ખબર નહોતી કે orthopedic surgeons are also requested to help
Yeah,
there.
we can help in administrative things.
Dr. Modha, comments.
All surgeons, not only
Oh,
orthopedics. It's
okay.
being a physician, chest
Uh-huh.
specialist, even neurosurgeons, orthopedic
Uh-huh.
surgeon, general surgeons, all sort of
Oh.
all sort of speciality. Whichever
Yeah,
consultant,
everybody.
if you are above MBBS,
You are invited.
wanted in the
Yeah, everybody was employed.
public sector,
Yeah,
because there was a shortage of doctors. So
yeah,
Hmm.
it
there
is
was a
our duty,
shortage of
humble
doctors.
duty,
Yeah,
to help the
because
country and help the patient,
yeah,
because it was too many patients, overloaded,
yeah,
and
yeah,
it's very difficult to provide them all services.
Hmm.
yeah,
But with the help of government, we are able to do it, and probably we are able to satisfy majority of the people, because you
yeah,
cannot satisfy everyone. But overall, the treatment in government hospital was up to the standard, and our doctors from IMA, doctors from Orthopedic Association, from
Hmm.
Neuro Association, all has provided their services free of cost.
Wow.
We have not charged a single penny to the government.
yeah. So it
So
was.
this is worth appreciating, that everyone has done his level best to bring the things out from this difficult situation. So that was our medical fraternity, and I salute everyone who has helped us or helped government to come out through this difficult situation.
Yeah. Those
So
1.5 months were very hard, and like
yeah,
everybody wanted to contribute whatever they could, in whatever capacity they could.
that was amazing. You see, I was not having a space in our COVID hospital for my relatives. It
Yeah,
was that tough situation.
yeah,
And we were all worried that if we suffered from COVID, what will happen to us? But
Oh my God.
fortunately, God is great.
yeah.
All, all
Hello.
to come.
Yes. Yeah, those
Yes,
days.
Rohan.
જેને આપણે કહીએ ને કે હવે આપણે ભૂલી બિસરી યાદે. શું કહેવાય
Yes,
એને?
yes. એવું જ છે, એવું જ છે.
એવું
It
છે.
is like that only.
All right. So, um, the next question I have for Dr. Rohan is, tell us something about your work with special children. And if you
Yeah.
can share some pictures or something, that would be great.
Special children are the sort of children that we every day see in our daily lives, but we often skip over them, or we fail to notice them properly. These are the children who need a lot of help in their daily activities, like like walking around, not only walking around but learning disabilities. They are difficult to train, they are difficult to stay with, even because they need a lot of help, even feeding or going to the toilet, or even all those things are different. So these are the special children who most probably had some problem during birth, like they had difficulty in breathing, or some blood sugar level went down at the time of birth, and they had some permanent damage done to their brain. And that damage, once that happens, it's difficult to go back and then heal it. So such children, they often have a lot of problems, as I said, difficulty in feeding themselves, learning disabilities, or even the milestones that they have, that is ability to sit or ability to stand, even those are absent. So in such children, I offer a lot of supportive aids, physiotherapy services. Other than that, if they are able to walk and they are not able to walk properly, we train them how to walk properly by giving them various aids like a walker or a stick, etc. And we try to modify their environment so that they are better able to fit in their house, or we try to create awareness in society also, that we make their lives easy by providing ramps everywhere for wheelchair, or public transport also we need to provide ramps there. So we try to create awareness from them. Other than that, if they are older, like around 10 or 12 years of age, and they have difficulty in walking because of their knee or ankle problem, then we try to do surgery and correct them, and then we are able to make them walk properly. Those things are very tricky. The surgical part is very tricky. It's often easier to harm them rather than give them genuine benefit. And selecting those patients, it requires a lot of experience, and a knowledge of their natural history, that is how they will behave 5 years from now, 10 years from now. So that requires a lot of experience, and that is the core of my practice when I'm working with special children, is predicting when a child will start to walk, because often these special children have delayed milestones. So what I mean by milestones is that there is a usually a specific time when a newborn child learns to stand, or learns to sit, or learns to walk. And often these special children, because of damage to their brain, the milestones are delayed. That is, a routine child will learn to sit at 6 months of age, but often these children, they start to sit at 2 years or 2.5 years of age. Other than that, sometimes the standing or walking is delayed by 4 to 5 years of age. So identifying these children, who is going to walk, who is not going to walk, sometimes they are so badly damaged that they can never walk in their life, and then making them do those activities. If they are not able to do it, helping them do it, or adapting their surroundings, so that even if they are not able to walk, they are able to function properly in society. All those things, they make up the majority of the time that I spend with special children. I'm associated with a large society here, Ramakrishna Mission, where we have almost 500 to 600 special children, and I do a free OPD there every month. And we identify those children, and the physiotherapy and all is also almost at free of cost there, like 50 rupees per session. So a lot of I do a lot of work with special children, and as being an orthopedic surgeon, I focus mainly on making them walk or making them function properly part. But other than that, I take an active interest in their social well-being, in their in their learning problems, and interacting with parents, and creating awareness in society. All those things also I try to participate in. Other than that, mainly I try to make them walk properly. That's what a pediatric orthopedic surgeon does.
Excellent. Thank you, Dr. Rohan. Dr. Modha, any comments?
No, he is doing very good job for our
Yeah,
society.
Yeah.
So that's
Thank
why
you.
I have called him on this our show, that he should
it's
be encouraged and he must do more and more
more good.
good work for the
Yeah,
society.
I started my private practice under Dr. Prakash Moda. I don't know if he
Oh,
remembers that. 5 years
I
back,
do.
when I was in Jamnagar, I started my private practice. I came visiting here every week, and I started in Gokul
Yep.
Hospital. I came there
Yeah,
for
yeah.
almost 2 years then.
Yes,
It's
yes, yes.
yeah, yeah. He's like an umbrella, and a lot of doctors have trained under him, been under him. He himself might not remember so many young doctors have benefited from him, but he is a true godfather to all young doctors here in Rajkot.
I'm going to add this in our introduction starting next show. The godfather of all doctors.
Yeah, you need to say
ના
that.
ના ના રહેવા દેજો.
Okay. But I think that may be true, right? કે તમને યાદ નહીં હોય પણ એમને યાદ છે જો કે
I
he started
remember.
there.
I remember. I remember.
Yeah, that was before the renovation of Gokul took place.
Yeah, yeah, yeah,
It
yeah.
was old
Correct.
Gokul. Your
Absolutely.
office was right there near the door.
Yeah, still it is there. But
Yes.
it is now settled. This I'm
Yeah.
sitting is a VIP room just behind the
Yeah.
reception. And
Yeah.
then
Yeah.
nearby is my office.
Yeah. Yeah.
Excellent. So, next question is, how severe is coronavirus risk for children?
So this is a really controversial thing that how risky is coronavirus for children. A lot of research is going on currently whether the children do have any severe conditions. So the thing is, there is a coronavirus infection and then there's falling ill because of coronavirus. The
Hmm.
coronavirus infection, the children are as susceptible as an adult, and they can contract coronavirus, but then becoming seriously ill and getting admitted to a hospital or requiring a higher level of care, so that is very rare in children, that they need to get admitted or require ICU treatment or those. But then there is a thing that happens in children after they suffer from coronavirus, and it is called a multi system inflammatory response that happens 6 to 8 weeks after coronavirus. And in that thing that happens in very rarely in children, like less than 1 in 100 or so. But if that happens, then they become serious and they need ICU admission and all that. But that is very uncommon. Otherwise, children do get coronavirus infection, but then they tend not to become seriously ill with them. So I think risk for children is quite low. There's a lot of talk going on about the third wave specifically targeting children. I think the government of India has also come out with the clarification that it's not the way it's being portrayed as. It's not that the children will specifically get targeted with coronavirus. It will happen to all of us if it comes.
Correct, correct. That is true. But the way people are talking is, oh, છોકરાઓનું ખાસ ધ્યાન રાખજો. Third wave ગમે ત્યારે આવશે. You know, the
Yeah,
rumors have
see,
already
it's the
started.
sentiment. It's the sentiment thing again.
All right. So the next question is, are there any special problems in post-COVID infected children?
So as I said, the children they often get infected with coronavirus, but
Dr. Rohan?
Just stuck up. It seems.
Yeah, maybe he'll get back.
Yeah.
Dr. Modha, you want to talk about
Yeah,
this?
yeah. I will. You know, pediatric orthopedic is a very, very special branch.
Mm-hmm.
And we found very few doctors who
Hmm.
is dedicated to pediatric orthopedic surgery. And Rohan
yeah,
is the only, yeah, very
He's
I
good.
back.
dropped out for a few moments there.
Okay. So, no, Dr. Modha was just saying this is very complicated branch, right? Pediatric
Yeah,
orthopedics.
yeah,
Pediatric
it's a
orthopedic, very few people are there in even Gujarat, all Gujarat.
yeah. That's why there are very few people, because it requires a lot of cerebral thinking. So, so
Yeah.
the surgeons are also very complicated.
Dr.
Also,
Rohan, that
what
was
I
very candid.
remember
Yeah,
in our residency that we used to listen and we used to joke that orthopaeds no brain, they work on carpentry.
no,
That was
it's
it.
not.
It
No, I need to survive in my
orthopaeds
community,
they
so it's not
just
like that.
but
That orthopedic
in this
surgeon.
time during the residency,
Yeah,
doctors
there's a
used
lot
to
of
sleep
thinking.
on the bench. They don't have a time to go for food, and you cannot imagine that situation. Residency in orthopedic is damn difficult. So as
Yeah,
in neuro. So
so
you cannot
it's because
imagine
residence
that
is difficult. Yeah,
worst residency in neuro and ortho. હું ભણતો ત્યારે
yeah,
તો રોહન, there were no CT scan facility, there was no MRI, અને હેડ
yes,
ઇન્જરીના
sir.
પેશન્ટ પડ્યા હોય એક ખૂણામાં જનરલ સર્જરી ભેગા,
Yes, sir.
અને
Yes, sir.
રેસિડેન્ટ્સ આવે, એક દી જોવે, બે દી જોવે, ત્રીજે દી ભાગી જાય.
Yeah. So,
કે
sir,
આ
like
તો
I'm very
રોજ
curious.
ઇમરજન્સી આવે.
સર ત્યારે સ્કલ કેવી રીતના ખોલતા હતા ત્યારે? અત્યારે જેમ ડ્રિલ
ત્યારે
યુઝ
સ્કલ
કરે છે,
ડ્રિલિંગ
વોટ
અમે હેન્ડ
ઇન્સ્ટ્રુમેન્ટ?
ડ્રિલ કરતા, હેન્ડ ડ્રિલ
હેન્ડ
વાપરતા,
ડ્રિલથી. યા,
હડસન બ્રેસ કહેતા એને. અને
હા.
પછી ગીગલી સો, એક વાયર આવે,
So,
that you, Rohan will be knowing it, wired to cut the skull. We
Oh
do two
God.
burr holes and we pass a giggly saw guide, and along the guide we pass a wire,
yeah,
and then we used to cut it, cut the
yeah.
skull
So
bone.
that's how you
So
used
it
to
was
cut
taking
open
a
the
long
skull.
time, very very long time. You know, one patient I
Yeah,
remember
but
in my life, that she had a meningioma involving the skull bone.
yes,
One day we did only burr hole, six burr holes we did,
yeah,
and
Wow.
we could, it was this much thick skull, and
yes,
we tired of doing a burr hole.
yeah,
There was no electric drill or any things. So
yeah,
for one day we did six burr hole only, and that
yeah,
was lasting for 5 to 6 hours. Then again
yeah,
we pack it back. Then next time after 3 days we reopen again and remove the tumor.
yes,
So this
yeah,
was the situation when
yeah,
I was a resident.
So
yeah,
you were doctor plus engineer plus mechanical work, everything together in this.
Yeah,
yeah.
yeah.
Like those were the days when everything used to be get done with the hand. There was no electric
There was
instruments
no
then.
electric machines or drills available. So we used
Yeah,
Wow.
to work very hard. So the neurosurgeon and orthopeds are very strong by their hands.
yeah,
Hence.
yeah. They are very muscular, and they
Yeah,
are used to using their hand,
yeah, yeah, yeah.
both of their hands.
Yeah, both
Oh my
hands.
God. Interesting, Dr. Modha. You are very great with sharing all this experience or knowledge. જેને કહેવાય ને આમ જ્યુસ ઓફ ઇટ. એટલે thanks for this comments. But આપણે ડિસ્કસ કરતા હતા, આપણે ક્વેશ્ચન પર જઈએ પાછા, which are there any special problems in post COVID infected children?
Yeah, so like I was talking about it, that after the children have coronavirus infection, they develop some multi-system inflammatory things. Inflammatory
Mm-hmm.
means the body, it reacts against its own self. So it reacts against its own antigens, that is, its own home tissue. So what happens is that a lot of swelling happens in all places of the body. And being a pediatric orthopedic surgeon, what I often see what happened after the second wave is a lot of children, they came with a limp. That is, they are walking abnormally. They don't have a lot of pain, but they are able to walk, but they walk abnormally. And it often happens suddenly, like the child was completely fine for 2 months after the coronavirus infection, and then suddenly one morning he wakes up and starts to limp. And then as the day progresses, in 2 or 3 hours the limp goes away. Then again the next day he starts to limp. So there is a typical the thing that happens after almost any viral infection, but after coronavirus, it happened a bit more, and that is what we call as transient synovitis. That is the hip joint that is there. It becomes inflamed. That is, it becomes swollen for some time. That happens often after a prolonged rest, and such things were seen commonly after this second wave. And treatment is, it's nothing. It's a self-limiting thing. It goes away in 14 days, but during those 14 days the child limps quite remarkably, and the parents are worried. So through this medium I would like to say that if a child is limping, it's good that you bring it to a doctor's attention, but then it's a thing that is going to heal on its own, and you just need to take some ibugesic while the phase lasts, and it's a common thing that we see, and you need not worry about it.
In Gujaratis. This is
Yes, yes,
very
yes.
important
This is
thing.
important. If you can translate in
So
Gujarati as well.
people who is Gujarati in all over the world, they will come to know what is they should take care.
આફ્ટર કોરોના વાયરસ ઇન્ફેક્શન પછી 1-2 મહિના પછી બાળક અચાનક લંગડાવા માંડે, એને દુખતું ના હોય, રાતના સૂતો હોય ત્યારે નોર્મલ હોય, પણ સવારે ઉઠીને અચાનક લંગડાવા માંડે ને આપણને એમ થાય કે અચાનક શું થઈ ગયું, ને લંગડાય તો એવો લંગડાય કે બીક લાગે એવો લંગડાય, દુખતું ના હોય, આખો દિવસ એક્ટિવિટી કરતો હોય, ચાલતો હોય, રમતો હોય, બધું કરતો હોય. તો આ કોરોના વાયરસ પછી એક વસ્તુ ટ્રાન્ઝિયન્ટ સાઇનોવાઇટિસ કરીને એક વસ્તુ જોવા મળે છે. કોઈ પણ વાયરલ ઇન્ફેક્શન પછી થાય, પણ આ કોરોના વાયરસ પછી વધારે જોવા મળ્યું છે. ને એમાં કંઈ કરવાનું ના હોય, ટ્રીટમેન્ટ એઝ સચ એની રીતે મટી જાય. 10 થી 14 દિવસ સુધી ચાલે ને જસ્ટ એક આઇબુજેસિક તાવની દવા જે તમે આપતા હોય એ જ એના ડોઝ પ્રમાણે આપવાની હોય ને એની રીતના એ મટી જાય. તેમાં ચિંતા કરવા જેવું કાંઈ ના હોય, ખાલી ડૉક્ટરને તમે એકવાર બતાડી દો કે છોકરો લંગડાય છે, તાવ નથી આવતો, 2 મહિના પહેલાં કે 3 મહિના પહેલાં કોરોના વાયરસ થયું હતું ને હવે લંગડાય છે, તો જસ્ટ ડૉક્ટર એકવાર જોઈ લેશે, વધીને બ્લડ રિપોર્ટ કરાવશે, પણ કાંઈ ચિંતા કરવા જેવું એમાં ના હોય.
One more thing, can you repeat in Sindhi?
No, no. It's, you'll
No?
have to ask my dad for that. You'll have to ask. You'll have to arrange an interview with him then. I'm very
Yeah,
weak with good Hindi. Like
it's Hindi.
even yeah,
Only
even in my home we talk in Hindi. Or my
Hindi. Yeah, talk in Hindi then.
uh, Hindi will, Hindi will be funny, sir. Then it will become a comedy talk show. Then
Yeah, okay. That's our
Maybe,
aim to
maybe
make the people aware.
aware.
That
Yeah.
is our
yeah.
aim.
So maybe the point is if શું કહેવાય, મને બી એટલું નહીં ફાવે, but if your kid is मतलब अगर आपका लड़का या लड़की लंगड़ा रहा है, then just contact the Dr. Rohan, right? That's all I would say. That's the
Yeah,
easiest explanation I can give in Hindi.
yeah.
Right?
Okay,
So that's my number
carry
displayed,
on,
I
please.
think.
Oh yeah, maybe we can let me show your number. So his number is 919979848626. So if your kid is having कोई भी अगर problem है with legs, पैरों में, हाथों में, then as Dr. Deki says, go fast. Time is the key. So time waste na कीजिए, and you can just contact Dr. Rohan Parwani in Rajkot. Is a very good, excellent orthopedic pediatric surgeon. So please contact him.
Okay,
That-
carry on next.
Okay, cool. So next question is no, this was very useful. I think we covered everything, right, Dr. Rohan? Is there anything
Yeah,
you want
yeah.
to add more?
No, that's it. That's it.
Rohan, do you want to show the film, that pictures, and can you talk something about the
Yeah,
correction,
yeah.
deformity, this, that?
So I'll share my screen then.
Yeah,
Yeah.
let me
Okay,
one
I think
second.
it's already sharing.
It's already shared. I just have to add it. So yeah. So this is the slideshow which Dr. Rohan is going to present today.
So
You want to talk
this is
about it?
yeah. So this is a child who has a birth deformity. You can see the foot; it's pointing inwards and upwards. So this is what we call as club foot. The child has difficulty in walking. If he continues to walk like this, it might become painful also. So we do some surgery here. Some do some releases there, and the foot becomes corrected, like you can see on the right side of the screen. This is an example of club foot. This is an example of club foot. Other than that, this is a child with bent knees, and we do some growth modulation surgery.
Next,
Are
We
you
do
show,
on
show
the next slide? Because we can't see it. If you can move to the next one.
so it's there. You can see. Okay,
Yeah,
can you see
now
it
I
now?
can see. Yeah,
Yeah.
now we can see. Yes.
So this is a child who has got a knee whose knees are bent. As you can see on the left side, she has got bent knees. And as I said, we can use the child's bone is growing. We can use the potential of the bone to grow to do some manipulative surgery around the growing ends of bone, and then by just small surgery, you can see on the right side a very small plate has been put, and the knees, then the leg has been corrected properly. So this is a growth modulation surgery that we do at a young age for deformed knees. Other than this, you can see. Can you see this child
Can
with
you
elbows
click
here?
next? Can you click
Click next,
next?
please.
Yeah.
Okay, right.
Yes. Yes. Now it's perfect.
So this is a child who had elbow fracture which was not treated properly, and then he ended up having deformity. And then I break the bone and correct their alignment, and then the elbow is completely normal and is able to move and function normally. This is another sort of work that I do. Other
Excellent.
than that, this is a congenital deformity where the
Can you
child.
click
Yeah,
Next,
next?
sure,
next,
sure,
please.
sorry, sorry,
Yeah.
sorry.
Yes.
So this is a child. This is an example of another congenital proper birth deformity where the forearm has two bones. In this child, the one bone is missing and the thumb is often not functioning, and there are only four fingers. The thumb is not there, and the bone underneath the thumb is not there. So what we do in this is we do some surgeries. There is a series of three surgeries that we do. We convert the index finger into the thumb. You can see on the left side there is a thumb there, and the hand looks pretty straight here. So we do some surgeries there. We rebalance the hand, and then the index finger is converted into the thumb. And you can see there is Radha written here. The Radha has been written by the child himself using his own thumb.
Wow.
So this is another surgery that we do for a radial club hand. That is a deformity, congenital birth deformity of hand. Of hand.
Excellent. This does require a lot of engineering mindset. That I can
Yeah,
tell for sure.
yeah. That's why I have gray hairs at 32 years of age.
Oh God. Okay.
Not necessary, no.
So So this is a
Okay.
child who has spinal deformity because both the hip joints are dislocated. They are since birth, and then I do again a lot of I do surgeries on both side of the hip and then put it in place, and then the deformity correction. The result you can see on the other side. This is another example of the sort of work that I do.
Excellent.
Yeah,
Thank
very
you,
good, very good.
thank you, thank you. And this is the last slide that I have, and you can see the knees are bent on the left side. This is a 13-year-old child, but you can see she is very short, and this is a condition of bone where the bones are very weak, and then they bend under the weight of the child's own body, and then I do corrective surgeries there, and the knees become straight as you can see on right side. So this is my last
Very good.
slide, and this is the sort of work that I do.
Excellent. Dr. Modha,
Excellent, Ron.
any
Very
Thank you,
good,
comments?
thank
very good. And
thank you,
very nice work you are doing for the kids. God
thank you,
bless
sir.
you, and you keep, please keep it up doing good job for the kids.
Thank you, sir. Thank you.
I
And
can hear some kids crying. I think they are validating his
Yeah,
work.
they are waiting in my OPD for it.
yeah, okay, okay. So
So, do
you
you have
have
time?
give your opinion on, and
Yeah,
with this remark we'll finish it.
yeah.
Tomorrow I'll tell you Dr. Mehul Mitra, who is a well-known pediatrician, senior pediatrician of Rajkot, will be talking along with his wife. His wife is engineer. She is
Oh,
a additional commissioner of Rajkot.
oh, nice.
Yeah, and she will be also talking how municipality or
Hmm.
how the Rajkot Municipal Corporation has worked in COVID, and Dr. Mitra will tell us his experience about COVID and what he has done in kids. So tomorrow is very interesting and very encouraging talk by one doctor and one engineer. You know,
Excellent.
so yeah. So tomorrow we'll see this thing. And thank you very much, Ron. We enjoyed the talk.
Thank you. Thank you, sir.
And
Thank you
it
for
was
having me.
absolutely correct and
Yes, it was
very
very
nice,
Yeah,
great.
very
sure.
informative talk for the common man.
Yeah.
And
Yeah,
we
sure.
hope that people should get something out of this our 1 hour program. And
Yeah, thank you, sir.
uh, it will benefits to all,
Yeah.
not only Rohan, but to all the society, that
Thank you, sir.
they
This is
should,
a wonderful
when
thing.
they should go, what they should do. Even not necessary that you should go to the private only. You can go to
Yes,
the
sir.
government hospital also.
Yes,
But
sir.
at least awareness is very important,
Important.
and that will help child to grow in a proper way and without deformity or less deformity. Child can grow, and that's the our satisfaction after the surgery.
Yeah. Thank you.
Yes,
Yes, sir.
Ron,
You're
thank
right,
you
sir.
very much.
Thank you.
Thank
Thank you
you,
for having me. Yes, sir.
thank you, and good
Thank
night.
you.
Thank
Good
you,
night, sir.
everyone. Please come tomorrow. And there are people watching us live. We haven't been taking their questions. I'm sorry. But if you have questions, please post us. તમે comment કરી શકો છો. And we will answer offline. Hopefully, Dr. Rohan gets some time and then I'll coordinate with him and get back to you guys. So,
Sure, sure.
thank you, everyone.
Thank you.
Thank you, Dr. Rohan. Thank you,
Bye.
Dr. Modha. Kale
Thank you.
madiye same
Thank you.
time.
Okay,
Sure.
Bye.
Bye. Bye.
7 p.m.